Hello, this is Dr. Eric Bricker, and thank you for watching AHealthcareZ. Today we're going to discuss the top 5 largest healthcare consulting firms in America. So we here on AHealthcareZ talk about healthcare finance. We cannot talk about healthcare finance and the healthcare industry without talking about healthcare consulting firms, because they are filled with strategic and operational direction for hospitals and health plans and many other actors in healthcare. So we have to understand who these healthcare consulting firms are. The number one largest one is probably a name that you're familiar with, and this is according to Modern Healthcare, they did these rankings, is Deloitte. Now, of course, Deloitte is a huge accounting firm. And then within Deloitte, they have a huge consulting practice. And so the consulting practice within Deloitte is a $2.7 billion a year revenue business. Now, the healthcare part within Deloitte Consulting, because they consult on other industries as well, is $963 million a year in revenue. So you take the $963 million, you divide it by the $2.7 billion. That means that about 36% of Deloitte Consulting's revenue is from healthcare consulting. Now, what type of healthcare consulting do they do? One of the main areas of healthcare consulting that all of these consulting firms do is something that is referred to as revenue cycle management, or just rev cycle, or RCM. What is revenue cycle management? It's billing and collections. Now, they call it a cycle because it starts all the way with admitting and pre-registration, making sure you got the right information on the patient, making sure you have the right insurance information, checking to make sure that their insurance still is covering them, see how their benefits are, whether it's a covered or a non-covered service, what's their deductible, what's their co-insurance, blah, blah, blah. Then it's collecting all of the charges that happen in the hospital. It's then taking all those charges and then translating that into a bill. It's then taking that bill and actually getting it out the door to Medicare, Medicaid, or a commercial insurance company like Blue Cross, United, Cigna, or Aetna. And then it's a matter of collections, following up with Medicare, Medicaid, Blue Cross, United, Cigna, and Aetna to then actually get paid and then posting the cash so that it's actually on the books. And that entire process is thought of as a cycle, or the revenue cycle. So this revenue cycle management, essentially the end result is to have hospitals get paid more faster. So Deloitte, among other consulting services, helps hospitals get paid more faster. Next up, Guidehouse, probably a name that many of you are not familiar with. It was the combination of a large healthcare consulting firm called Navigant plus a division within PricewaterhouseCoopers, plus they added some additional acquisitions of other consulting firms as well. Now, they do a total of $970 million in consulting revenue. Again, they do other industries besides healthcare, but about half of their consulting revenue does come from healthcare. So about $485 million a year in revenue comes from Guidehouse's healthcare consulting. Now, interestingly, again, they are the second largest, specifically for revenue cycle management, for this rev cycle consulting. They're the second largest firm in America for that. They've done these consulting projects for over 250 hospitals in America. And Guidehouse, as a total company, is about 7,000 employees, which, let's just say, so about half their revenue comes from healthcare. So let's just say half their employees work on healthcare projects. That means that they have about 3,500 healthcare consultants that work at Guidehouse. That's an approximation. But then that gives you an idea about, how many healthcare consultants they probably have at Deloitte, right? Because Deloitte is doing $963 million, which is about twice as much as the $485 million that Guidehouse is doing. So Deloitte probably has about twice as many consultants as Guidehouse does. So Deloitte probably has about 7,000 healthcare consultants. So when we're thinking about the size of these consulting firms, I'm just trying to give you some context, both in terms of revenue and the number of employees and the types of consulting projects that they do. Okay, next up, interesting, Optum is the third largest healthcare consulting firm in America. Now, all of these, when I say healthcare consulting, this is on the provider side. They do provider consulting. And obviously the majority of the money on the provider side is on the hospital side. So you can almost think of these as like hospital consultants. Isn't that interesting? Optum is the third largest hospital consultant in America. Now, obviously it's a part of UnitedHealth Group. Now, they said that they did $755 million in total consulting, which is kind of weird, right? Because that's more than number 2. But I think the reason that they're ranked number 3 is that because Optum actually does a lot of consulting for health insurance companies as well. And so if you took out that health insurance company consulting and you just looked at the provider consulting, because they absolutely do consulting for hospital services as well, then that puts them at number 3. Now, do they do rev cycle consulting? Absolutely. Optum has a consulting service that helps hospitals get paid more faster. Now, wait a second. If you have UnitedHealthcare as your administrative services only, isn't UnitedHealthcare going to be telling you, the employer, that we're going to help lower your healthcare costs, right? Because essentially, if a hospital is getting paid more faster, the end result for that for an employer is that their healthcare costs will go up faster. So that seems to be a conflict of interest when you have one part of UnitedHealth Group's business trying to increase healthcare costs by helping hospitals, and yet you have another part of the same company that's trying to do the exact opposite. That seems to be a conflict. Now, they specifically work in areas of charge capture and coding optimization. In other words, trying to make the bills be larger that are going out. And also specifically on the revenue cycle optimization, that's the faster part, getting paid faster. So let's look at a specific example. The Georgia state employees use UnitedHealthcare as their plan administrator. Your health insurance, if you work for the state of Georgia, is through UnitedHealthcare. Well, there are major hospital systems in Georgia as well. Wellstar, Piedmont, Emory. So if Optum and their consulting group was going out to Wellstar or Piedmont or Emory, like if the Optum consultants were doing a really good job, that would end up costing the state of Georgia more money. So I guess, would the Optum consultants have to recuse themselves from having to work with a hospital system in Georgia because the same company administers the employee benefit plan for the state employees? I don't know, but that appears to be a conflict of interest. Okay, next up, you've got Vizient. What is Vizient? It's actually a group purchasing organization. It's one of the largest, the big 2, Premier and Vizient are the big 2 GPOs. They do group purchasing for hospitals, whether it be for software, but also for things like their laundry services, like their sheets. Okay, so they do all this group purchasing for hospitals, but then they have a consulting arm within Vizient that actually does $210 million a year in consulting. Again, and they do revenue cycle consulting for hospital systems as well. And then number 5 here on the list is the Huron Consulting Group that does $378 million in annual consulting revenue. Now, keep in mind, believe it or not, when I started out, right out of college, I was a hospital consultant, and I specifically worked on revenue cycle management programs. So, and I specifically worked for a company called Stockcamp and Associates that was bought a long time ago by Huron. So if you go on my LinkedIn profile, you will see that it says that I used to work for Huron because I worked for a company that was acquired by Huron. Now keep in mind, this was back in the late 90s, so this was over 22 years ago. But yes, I used to work for, and I still know people that work at Huron to this day that work on revenue cycle management projects for hospitals to help those hospitals get paid more faster. That's the goal. Now, notice who is not on this list. Who's not on this list is McKenzie. Now, of course, McKenzie is a private company, but McKenzie does absolutely a ton of healthcare consulting. Now, they do it for hospitals, but they also do it for health insurance companies, and they also do consulting for pharmaceutical companies as well. They obviously do a lot of strategy consulting. Because they're a private company, they tend to be much quieter about their revenue and who their customers are, so it's harder to figure this stuff out. But just know that McKenzie absolutely has a healthcare systems and services practice. Now, what's my punchline for today? We have all these people working in healthcare consulting. My one wish for all of these people is that instead of doing consulting projects on revenue cycle to improve charge capture and coding optimization, wouldn't it be great if these healthcare consultants worked on clinical optimization to decrease the variability in cost and quality that exists within a hospital system? We know that healthcare is highly variable by physician. We know that healthcare is highly variable by specific facility. These hospital systems have dozens of facilities, dozens of hospitals, dozens of ambulatory surgery centers, dozens of outpatient clinics. There's massive amounts of clinical variability where one patient will be treated very different than another patient with the exact same condition in the exact same scenario, depending upon which hospital they go to within the same health system, depending upon which clinic they go to within the same health system. And frankly, a lot of the expertise of these consultants could help these hospitals improve this. So my one wish, if I were to snap my fingers, is that if we could get all of these healthcare consultants to help hospitals with their clinical optimization, to help with clinical improvement programs, I think it would be time well spent. And that's my point for today. Thank you for watching AHealthcareZ.